name is Amy. I'm a therapist at Restore Life. I'm here with Karen, who came to us diagnosed with stenosis, narrowing canal in the spine, a narrow neck hole as you call it.
Yes, I do. 'Cause that's what
Degenerative discs, and she's also had cerebral palsy for 60 years. So Karen, I know you came to us looking for a solution to help you. How did you, first of all, find out about us, and what other treatment options did you try before coming to our facility?
Well, what happened, Amy, is I saw a commercial on TV for a place in Tampa that said they could fix it through surgery. And I went over there with some friends, and I wasn't happy. It looked like a warehouse, and my friend said, what if it becomes worse, and what if you're paralyzed? And that scared me. And so I said, no, and I had never heard of Restore Life. I just knew I didn't want that, and I thought, well, I'll probably have to live with this pain. It was pretty bad some days. So I was watching TV one day, and a Restore Life commercial came on, and because I had a DVR, I reran it to watch the commercial again and thought, oh, I should check into that. And so I called and made an appointment, and Nicole spent a lot of time with me talking about my condition and what she thought Restore Life could do for me. And I asked her if there were insurance, and she said no, and I thought, well, it's still worth it to me.
And you went ahead and did stem cells, PRP, laser, you did the full combination therapy?
I did, because it made the most sense to me. I actually had 5 shots in my neck, and they say that it would take up, or they said it would take up to about a year for it to be fully in. So I still have a few months to go before I feel the full effect, and I feel so much better. I have more movement in my arm, and my neck does not hurt, which is phenomenal. And
so when you first came in, on a scale of 1 to 10, your pain level was roughly
7, 8.
And it was chronic.
It was chronic.
Now you're coming in now, what would you say your pain levels are?
Most days 0 to 1.
0 to 1?
Mm-hmm.
And I know we had discussed the use of your left arm
Mm-hmm.
and the lack of fine movement skills, fine motor skills,
Yes.
right? And you feel that those have improved,
Improved
with your treatment?
tremendously. Yeah, what I show friends at work is I can pick up a cup and get myself water holding the cup in my left hand, which I was never able to do before.
And they've noticed improvements
They've
in
noticed,
you
yes,
as well,
and
correct?
I don't trip as much as I used to either, which is really good.
That is excellent.
Mm-hmm.
So if you could say, I know you're a very active person, so what kind of activities you're into? You're into...
I play tennis as much as I can. I swim, I ride my bike, and I walk a lot.
And do you feel like having this treatment has helped you?
Oh, tremendously, because I don't feel any pain when I'm swimming. Actually, when I would play tennis before I had this treatment, stretching out my arm actually helped the neck, which is now what I understand. So the tennis didn't really change, but the swimming did, and the biking. And when I can turn my head better, looking to see if a car is coming.
And if you could tell people about your experience here as far as your interactions with Nicole, your consultation, dealing with the staff.
Well, I think the staff is wonderful. It's a very collegial staff. When I have noticed that people help each other out. They ask each other questions. Doesn't seem to be any territorial. That's my patient. Don't look at him or her. None of that, which I've seen in other places where people get very jealous or insecure. I don't see that here at all. Nicole is a good administrator, and also she's very caring. She will ask patients, because when I've been waiting for my treatment, I've
So
seen
the
her
follow-up
talking.
is really good.
The
It's
follow-up.
very important.
Yes. Yes.
Would you refer your friends and your family here?
I have. I don't know if anybody's come, but I've told 4 or 5 people about it.
That's excellent. All right, Karen, thank you so much. I really appreciate it.
Oh, you're welcome, Amy.
All right.